Excel College of Physiotherapy and Research Center. First of all, behalf of an Excel College, we congratulate those who are all appearing in MRB examination. Yes, let's start the sessions. So in our morning session, we discussed about our Tamil preparation and preliminary examinations. And now we discuss about the electrotherapy sessions. Okay. So first of all, we want to know the introduction of the electrotherapy. So what is meant by electrotherapy means, which is nothing but the therapy means which is the treatment, and electro means the electrical current. We're going to provide the treatment with the help of the electrical current or electrical devices were known as electrotherapy. Yes. So under this electrotherapy, we divided into three categories based on the frequency level, which is nothing but the low frequency, medium frequency, and high frequency. Yes. Based on the electrical current units, we're going to divide it into the three category of low frequency, medium frequency, and high frequency. So these are all the content is the combination of electrical therapy devices. So what are all the frequencies are comes under the low frequency, and what all the frequency units are comes under the medium frequency, and what all the units were comes under the high frequency. Yes, the low frequencies are from the 100 to 1000 hertz of the frequencies were known as low frequency. From the units of 1000 to 10,000 hertz of frequency units were comes under medium frequencies, and more than 10,000 hertz of frequencies were known as high frequency currents. So coming to the examples of these three currents, so the low frequency current examples are muscle stimulator, which is the combination of Faradic current and galvanic current, right? So coming to the medium frequency current examination, which is nothing but the IFT and Russian currents. Yeah. And coming to the examples of high frequency units, which is nothing but short wave diathermy and ultrasound. So these are all the units where comes under the about 10,000 hertz of the frequencies where comes under the high frequency units. So I hope till now, as we all know, what are the currents and frequencies where comes under low, medium, and high frequency currents. Yes. So coming to the session, so first we start to the Faradic current. We'll start from low frequency unit. So I already told. So what is meant by low frequency unit? The frequency units are much in between to the 100 to 1000 hertz of the frequencies are comes under low frequency currents. And the major examples is muscle stimulator. So muscle stimulator is the combination of Faradic current and galvanic current. Faradic currents were otherwise known as alternating current, and galvanic currents were otherwise known as direct current. So these direct current were otherwise known as interrupted direct current, which is IDC. Okay, so these IDCs are already known as galvanic stimulation of the current. Listen to it. So now we'll start from the Faradic current and followed by galvanic current. So coming to the Faradic current. Yes. So first of all, what is the definition of the Faradic current? Which is the short duration of short duration of interrupted unidirectional flow of the low frequency currents. Unidirectional flow of low frequency currents. The definition resembles to that short duration of interrupted. So what is mean by short duration? So before that definition, we want to know the schematic diagram of the Faradic currents. So Faradic currents were otherwise known as alternating current. So what is mean by alternating? Based on the frequency of waveform, the waveform units were altering from the normal muscle and nervous problem. Okay, so the short durations were resembles to this. Okay, and what is meant by the interruption? Okay, the frequency of waveforms going to interrupt of the total duration. So this is about the total duration, that is the horizontal axis, that is y axis, and this is the vertical axis, that is I. Okay, the I's were nothing but that is the intensity of the electrical current, and this y, that is nothing but the d. D resembles to the duration. Durations are pulse durations. Okay, so these frequency units going to alter the waveform. So that is known as alternating current, which is going to interrupt from the one period to another period. So basically, these halves were known as rectification. So what is meant by that? So that is rectification. So this is the first half of the waveform, and this is the second half of the waveform. Okay, so totally these all waveforms were known as rectification or full wave rectification. Full wave rectification. And first, similarly, these halves were known as half wave rectification, and this second half were known as second half of the rectifications. So totally we are having the full waveform here. So this is the first wave of the rectification, and this is the second wave of the rectification. So totally this is the first half and second wave were combination of full wave rectification. So this is about the full wave rectification. Yes. So coming to the definition, which is the short duration of interrupted unidirectional flow of the electrical current, right? And this is what mentioned the short duration. So this is the waveform, I already told that, and this is the intensity of the electrical current, which is the x-axis or vertical axis, and this is the y-axis and horizontal axis, which is resembles to the pulse duration. Is simply that mentioned to that d. So this is the wave of. Okay. As of now, we discussed about the definition of the Faradic current. So I'll read once again because of the poor network connection. So which is the short duration of interrupted unidirectional flow of the electrical current. The short duration, that is resembles to the first phase of the rectification and the second phase of the rectification, that is the 0.1 to 1 millisecond of pulse duration, that is the short duration. And the interruption, so what is meant by the interruption? The single waves going to interrupted in between the electrical stimulation, that is nothing but the resting period, otherwise which is known as off period. Off time or off period is known as the interrupted and unidirectional. So whatever the electrical flow, whether it is the direct current or alternating current, so whatever the electrical flow of the currents were unidirectional only. This is not the multiple directional, which is the unidirectional only. So that is the unidirectional flow of the low frequency electrical current. So low frequency currents were resembles to the 0.01 to 1 millisecond, and the frequencies are 50 to 100 hertz. So this is about the simple and brief definitions for alternating current. So coming to the biophysics of the alternating current. So in whatever the current, we have the basic unit that is known as the physics. So in which type of the electrical current which is going to movable from the one portion to another portions, the basic concepts under the physics. So what is the biophysics of Faradic current? Yes. Based on the schematic picture, we're going to resembles the Bay picture. Okay, so this is the common picture for Faradic current, and this is the biophysics of the Faradic current. So what is the differences between those two? So here the frequency units are same for all those things. So that is known as unmodified electrical stimulations. So this biophysics comes to the modifications of this unmodulations. Okay, so this is the modification. So what is that? So I already told this is the first half of rectification and this is the second half of rectifications. So totally this is the full form of the rectification. So this is the first half. So this is the first half which is totally different from the second half. Okay. So this is the intensity of the electrical current. So this is also intensity of the electrical current. And this is the pulse duration of the electrical current, and this is to the pulse durations of the electrical current. So what is the differences between the first half and second half? So in this first half, the intensity of the electrical currents are too small. Here the intensity of the electrical currents are large. So here the pulse durations of the electrical currents are long, and here the pulse durations of electrical current are short. So coming to the motion, so in our first rectification, that is the small amount of intensity of frequency and long amount of pulse durations. That is same vice versa to the second half of the rectification, that is short amount of the pulse duration and long amount of the intensity of the frequency. So this is the vice versa practicals we are seen into the biophysics of the Faraday current. Clear? Yes. So coming to the modulations. So what is meant by modulations? So modulations are nothing but the based on this frequency unit, what all the modifications are there, that is the seen portable to that modulations of the current. So this is two type basically, which is modification and unmodifications. So first one is the modification, and second one is unmodification. Yes. So based on the wave of electrical stimulation, based on this wave of electrical modification, and what is meant by unmodifications. Though these waveforms have current that is known as unmodifications. So if there is any modulations we are going to see in this frequency of electrical current, that type of electrical currents comes under the modifications of the electrical current. Examples. So come to modified and unmodified. Yes. So these all type of modulations based from this type of schematic picture only. Okay. So here we have same amount of the frequencies are there. Okay. So here it is the 0 unit, and which is the intensity, and this is the duration. This is the horizontal y-axis, and this is the vertical x-axis. Right. Okay. Here there is no modulation in between to the frequency of the electrical current. That is known as unmodified electrical current. So coming to the modified electrical current. So first one, which is the triangular shape of the rectification, and second one, trapezoidal, and rectangular, and finally short tooth. So these four modulations of the waveforms where comes under this modified electrical stimulation of the Faradic current. Okay. So coming to the triangular waveforms. So this is about the triangular waveform. Okay, and this is about the trapezoidal waveform. And this is about the rectangular waveform. And what about short tooth? This is the short tooth. So coming to the point, which is the zero unit for all the type of modulations. This is about the intensity of the electrical current, and this is about the duration of the electrical current, right? Okay. So what is meant by triangular? The shape of this frequency currents is known as triangular particles. So first, the intensity of the electrical current, we are going to increase the intensity knob, which is gradually increased of the electrical current once it's touched to the peak level. So here, what is meant by the peak level? So every patient is having the alternating type of the waveform. So depends upon the patient to patients, the frequency units were going to get changed. So based on that, the frequency of the electrical currents were gradually increased, and once it's touched to the peak level, which is come to that zero base level, which is gradually. That is not immediately, which is the gradually. So coming to the triangular shape, which is gradually increased amount of the electrical current, and once it's touched to the peak level, and it's about the triangular. So coming to the trapezoidal. So the shape of the trapezoidal, the modulations of the electrical frequency units were going to get changed. So from the zero level of the intensity, we're going to increase the intensity knob, which is going to start the contraction of the muscle, which is gradually increased level and which is maintain some amount of the peak level, and which is suddenly is going to reduce to touch the zero level. So here and here. So here, sir, the current are gradually increased, and here also gradually increased, and here is the differentiated, which is the sudden increased amount of the intensity, which is going to touch to the peak level, and it is suddenly reduced to the zero level. So from the treatment time to the end of the treatment time, the same amount of the rectangular shapes will be modulations are there. So that is the modified electrical current of Faradic. Okay. The final stage, that is the short tooth. So this is the shape of the short tooth. The intensity of the electrical currents were started, which is the gradual unit. So which is the muscle contractions were started. Once it is gradually get increased and get suddenly reduced. So from the treatment time to at the end of the treatment time, so this is the flow of electrical current. So alternatingly, the pulse of the electrical units going to get modified. So that's why these four type of the units were comes under the modified Faradic current. So what are the modified? That is the triangular, trapezoidal, rectangular, and short tooth. And this is the unmodulation unit. So as of now, we discussed about the definition, basic physics, and modulations. So these three subtitles were going to complete now, and followed by we're going to discuss what are the physical effect of heat. So what are the physical effect of heat? So whatever the current we're going to apply over the patient surface, which is going to create some amount of heat molecules, right? So this is the application of heat. So what going to change after application of heat, which is the modulation of vasodilatation, right? So what is mean by vasodilatation? So vaso means that is the blood vessels, and what is mean by dilatation? The diameter of the blood vessels were going to get increased. So that is were known as vasodilatations. So how the vasodilatations were occur once we are going to apply it over the heat? So that is the mechanism. Once we are release of histamine. Histamine is one of the hormone which is going to changes the vasodilatation period once we're going to apply the heat. This is the one of the manner. The second manner, spinal cord dorsal root ganglia. Spinal cord dorsal root ganglion. So only we are going to apply the heat. So either this way or this way, the vasodilatations will occur. So I already told what is meant by vasodilatation, which is the dilatation of the blood vessels once we are going to apply the heat. So either the secretion of histamine or stimulation of spinal cord dorsal root ganglion going to change the vasodilatations, right? So which is the local treatment area. So which is otherwise known as local area or treatment area. So what happened after the vasodilatation? So other vessels are like this. What happened once the blood flow were increased to the local treatment area because of this vasodilatations, right? So what happened the vessels? So what are the changes may occur the vessels because of this blood flow increased? Yes, which is increased vascular capillary permeability. Increase which is increased vascular capillary permeability, right? So what does mean by vascular capillary permeability? The capacity of the vessels of blood vessels were going to increase because of increased amount of blood flow, that because of vasodilatations, right? So first we are going to apply the heat, that going to the changes of vasodilatations, so that is nothing but the vessels of the diameters were going to get increased, either the secretion of histamine or stimulation of spinal dorsal root ganglion. That is the result of vasodilatations. So due to this vasodilatation, the blood flow, amount of blood flow are going to get increased. That is the increased amount of blood flow, right? So due to this increased amount of blood flow, what are the changes may occur over the blood vessels? That is the increased vascular capillary permeability. The ability of capacity of blood holding amount were increased over the blood vessels. That is the vascular capillary permeability. So what is the result of vascular capillary permeability increase, which is the increased in part of O2 supply plus nutrition supply. So increase the supplications of O2 supply and nutrition supply over the inflammatory part or any injured part, right? So that is the result of automatic pain reduction. So these are all the physical changes may occur once we are going to apply the heat. Okay, so I'll repeat once again. So first we are going to apply the heat, and the result of vasodilatation due to the histamine secretion or spinal cord dorsal root ganglion. That is the result of increased blood flow, and that blood flow results shown to the vascular capillary permeability increases. That is the result of O2 supply and nutrition supply to the lesional area. So the obstructions of this O2 and nutritions, automatically the pains were going to reduce. This is the simple physical fact behind the physical effect of heat. Clear? Yes. And coming to physiological effect. Physiological effect of Faradic current. So in the Faradic current, usages over the sensory nerve, Faradic current usages over the motor nerve, the effect of muscle contraction, and the effect of innervated nerve, So basically, the injured muscles were divided into two types, right? So that is the innervated group of muscle fibers and denervated group of muscle fibers, right? So what is meant by innervation? That is the nerve supplies were properly intact to the particular group of muscles were known as innervated. One. What is meant by denervated? There is any branch of nerve fibers we are going to cut into the particular group of muscle fibers. So for consider, this is the group of muscle and this is the supply of nerve. Some branches of nerves were supplied into the group of muscles. So in this branch, any type of nerve roots were going to cut in these three bands. So that is known as denervations. There is fibers we are going to use into the galvanic current. Okay, that is nothing but the interrupted direct current or direct current. So either interrupted direct current or direct current and galvanic current. These three similar to the denervated nerve fibers, and denervated fibers we are going to supply over the Faradic current. So that's why I mentioned here that is the effect of only the innervated muscle fiber. So coming to the yes. So coming to the part of the sensory nerve. While we are applying to the Faradical current over the sensory nerve that stimulate pin prickling sensation. Pin prickling sensation, which is going to immediately to target over the synapse. So what is meant by synapse? Which is the continuation of one neuron to another neuron. Okay. Which is the demyelinated nerve fibers, and this is the another nerve fiber. Okay. So what is meant by synapse? Which is the intermediate portion from one neuron to another neuron. The impulses were transmitted. So that is known as synapse. So once we attack over the hemiplegia, which is innervated process, so here the synapses are coming to the near nerve. So once we apply to the Faradical current over the sensory node, which is going to stimulate the pin prickling sensation, which is going to reflect over the synapse. So synapse was situated in between portions of one neuron to another neuron. So what is the function of this synapse? Which is transmit the unit from one neuron to another neuron. Okay, so this is the basic concept from the use of Faradical current over the sensory fibers. So coming to the motor unit. Motor nerve stimulation and followed by muscle contraction, right? These are all the effect of Faradical current and sensory. So over the sensor nerve, we are going to apply it over the electrical current that is stimulate to the pin prickling sensation. So coming to the motor nerve stimulations. So once we are going to apply the Faradic current over the motor nerve, that's going to stimulate the muscle contraction over tetanic type of muscle contraction over muscle, while we are applying to the Faradic current where to the motor nerves. So coming to the muscle contractions. So under the muscle contraction, we have divided into the two portions. That is the venous return and metabolism. So once the Faradic currents were applied to the electrical current to the injured muscles, means once which is the venous returns were going to get improved and metabolisms were going to get improved because of the physical effect of heat. Okay. physical effect of heat, the venous returns were going to get improved, and automatically the edemas were going to get reduced, and metabolism is also going to get improved. So these are all the basic concepts behind to the physiological effect of the heat applications of Faradic current. So coming to the therapeutical effect, that is re-education of muscle action to promote muscle action and to regain the new muscle action you are going to increase the muscle power from 0 to either 2 or 3 or 4 and nervous lesion. So what is the type of this nervous lesion? Based on the Sutherland classifications and Sedan's classifications, which is the 3 types of the nerve lesions, that is neuropraxia, axonotmesis, and neurotomesis. So if there is any the combination of muscle, we are going to apply the Faradic current and galvanic current. So followed by, we are going to see in the galvanic current for the next session. Okay, we'll wind up here. Okay, so some of the content we discussed today about the Faradic current only. So in this session, you people have any doubt almost. So we are going to clarify to that next classes. Thank you.